Alzheimer's disease is incredibly debilitating for both sufferers of the illness and for their loved ones. It's characterized by progressive memory loss and the inability to complete the simplest of tasks, eventually leading to death. These symptoms are a result of changes in the brain, particularly in the memory center called the hippocampus. These changes are an accumulation of proteins, specifically clumps of the beta-amyloid protein called beta-amyloid plaques, and tangled bundles of the tau protein that cause neurons to die, shrinking the brain tissue and enlarging the cavities of the brain, destroying its functions. Currently, scientists are struggling to find a cure that will stop, much less reverse, the effects of this neurodegenerative disease. However, there have been several attempts at treatments for symptom management. Current therapies used for symptom management of Alzheimer's disease include pills such as cholinesterase inhibitors, which help prevent the breakdown of specific neurotransmitters, and memantine, which helps balance glutamate in the brain, but they have low effectiveness. Intranasal administration is a more promising delivery method for Alzheimer's disease therapeutics, but only works for smaller drug molecules. One of the greatest issues in finding a cure for Alzheimer's disease is the lack of precise and reliable biomarkers. Biomarkers are biological indicators that are needed to measure the presence and progression of a disease and determine the effectiveness of a therapeutic. Additionally, delivering drugs to the brain is extremely difficult due to the presence of the blood-brain barrier, a selectively permeable diffusion barrier which surrounds the brain as a protective layer and only allows certain molecules to pass from the blood to the brain. In this sense, the blood-brain barrier can be thought of as a door that is only able to fit objects of a certain size. The blood-brain barrier is complex and selective, which makes it challenging to develop models that predict the efficacy of a drug's transport to the brain. Some therapies have tried to break the blood-brain barrier in order to administer drugs directly to the affected regions of the brain, but have had issues with specificity, safety, and failure to deliver sufficient amounts of the therapeutic. However, in 2017, when scientists at Sunnybrook Hospital revealed a patient had successfully undergone a procedure to non-invasively open the blood-brain barrier, the once unpromising fate of Alzheimer's disease treatment had been flipped completely. This procedure is called magnetic resonance guided focused ultrasound. Magnetic resonance guided focused ultrasound uses a transducer helmet and various converging energy sources to target specific areas of the brain. When coupled with intravenous injected microbubbles, the microbubbles, represented in white, oscillate in the capillaries of the brain. This opens the tight junctions of the capillaries and the blood-brain barrier, allowing drugs, represented in red, to pass through to the affected regions of the brain. In this way, focused ultrasound opens a larger door that enables larger objects, such as promising therapeutics, to fit through. The ultimate goal of this treatment is to reduce the beta-amyloid plaques and tau bundles to subsequently improve memory. The advantages of using this treatment method are that it provides real-time feedback on the efficacy of the treatment and has high spatial and temporal specificity, allowing for specific regions of the brain to be targeted rapidly. This technology has previously been used at much higher frequencies to ablate damaged areas of the brain, and has even been used in clinical trials at lower frequencies for the treatment of other neurodegenerative or neurological disorders. But its use for Alzheimer's disease is currently in phase 2 of clinical trials, targeting more areas of the brain with more participants, and has yet to be used in conjunction with a therapeutic on humans. However, the treatment has been used in conjunction with therapeutics, such as anti-beta amyloid and anti-tau antibodies in multiple animal studies, and has even been found effective against the pathophysiology of Alzheimer's disease in mice. One animal model used these antibodies in 2 different treatment plans: a one-time treatment, which reduced beta-amyloid plaques to about 62% of their original volume, which persisted for 2 weeks, and another treatment plan performed 3 to 5 times biweekly, which significantly decreased plaque surface area and number, which had more promising and permanent effects for moderate to late stage Alzheimer's disease. Another animal study was able to increase hippocampal neurogenesis significantly using focused ultrasound after just 2 treatment sessions. These animal models have proved that this treatment is able to promote beta-amyloid clearance, delivery of endogenous antibodies, and activate microglia, which are brain cells that help the immune system clear out any dangers to the nervous system. Since these animal models were so successful, scientists were able to begin human trials testing the efficacy of the focused ultrasound and microbubbles without any therapeutic just yet. One human trial proved that a random section of the blood-brain barrier was able to be successfully and safely opened and effectively closed back up after a 24-hour check-in. In another human trial, the hippocampus was specifically targeted and was also able to be successfully opened, followed by closure of the blood-brain barrier after a 24-hour check-in. This study demonstrated that 95% of this target area of the brain was able to be opened without opening any other part of the brain. These participants showed no adverse effects of this treatment. However, researchers should continue to look for possible drawbacks, including persistent microhemorrhages, swelling, neurological defects, and of course, death. The next steps for the future of this promising treatment are to combine the technology with the use of a therapeutic to hopefully see improvements in patients' memory and improve the quality of their lives.